When it comes to lung screening, the most powerful, life-saving scan we have and the simplest scan, nobody knows about it. And so how do we get that message out to somebody that isn't really interested in healthcare news, but explain it to them and convince them they need it? You got to take the technology to them, and you got to do it in a way that people ask questions. What are you doing? Why are you here? There was no other way except doing something like a mobile bus. The challenge was there wasn't one to buy. And so we had to really start from scratch, come up with a concept, build it, and put it on the road and start learning. We started in 2018, and it was really an eye catcher. People were curious, but it creates that conversation and buzz. We were asked to go to a lot of places where people wanted to see it. And we quickly had to turn that into the fascination of wanting to see it to actually scanning. What we did was say, you don't have to take a day off from work. You can do it on your lunch break. Time you'd fill up your car with gas, you're going to pick up a meal at a fast food restaurant. We can achieve something that is pretty incredible, simple, and yet may save their lives. And that was probably what surprised the public the most. Not that you could put a CT scan machine on a bus, but you could actually do healthcare that simple.
I think most of us are hesitant to get screened because of what we might find out. Once you get to be a certain age, you know the screening is not an option. You have to have it done. Having gone through the lung bus itself personally several times, I can tell you I was very surprised. It was quick, it was easy. I was in and out of the whole unit in way less than 10 minutes. I was surprised by how smoothly the entire operation ran, how quiet it was, and how quickly I was able to get the results.
Because I smoked, my doctor recommended that I get the screenings every year, and I did. I was happy that it was always close to my home. It was within 10 minutes of my home. So it worked out really great. And I had early detection. It was in stage 1 whenever I found out that I had cancer. I had radiation and it got rid of it, and I've been cancer-free for a year now.
It's not just about lung cancer, that we find a lot of different things, good and bad. When I was screened originally by the CT Mobile Lung Program, they found a thyroid nodule. Then I went back several years later doing our routine screenings, and they found out that from my recent heart surgery that my sternum did not fuse together and I had a broken sternum wire. Incidental finding. So it has been very beneficial to me.
You got to find that key place that people convene. And there's certain stakeholders in every community, and that's part of doing the preliminary work to search out who those people are and where that place is. If you start scanning people, you will find lung cancer when it's curable. You'll change people's perspective, and those people become your marketing agents. They'll go and start spreading the word in their community.
I've personally been affected by this. My sister-in-law, 50 years old, died, cancer, and we just felt like it was a thing that needed to be done. So we brought it to the church, and we had 50 people turn out, most from our Sunday school class and friends. They found one gentleman who was in our Sunday school class, picture of health. He had 5 bypasses done shortly after, and then they found one cancer victim within the early stages, which was a great thing.
The lung bus typically comes out once a quarter, and as I've been there, I've been promoting it more and more because I've seen the value in it. Everybody that comes in our store, there's a promotion in there and we talk about it, or there might be a sign up that says that the lung bus is coming. And if somebody happens to be a high-risk patient, we'll call it to their attention, and then this would be a form of preventative medicine.
Some of our biggest screening events have occurred from these school events where we challenge the kids to get people signed up. So using them to get their parents and their grandparents, using the school social media allowed us a way of getting that messaging out. We would teach classes, we would spend a whole month with them, and it's been a powerful way of hopefully encouraging some to go down into the fields of a lung cancer related field, but also help us get that messaging out in the community that's different than a billboard or mailing or magazine.
I attended the lung screening van at my daughter's school because they had an event there and I was able to get my screening that day. My first screening in the mobile van showed a little nodule in the left lobe of my lung. They asked me to come back in 6 months to be rescreened. The van came back to my neighborhood and I was able to be rescreened. At that time, I was diagnosed with stage 2 breast cancer. That cancer was a very aggressive cancer, and it was able to catch it, and my lymph nodes were clear because of the early detection in the lung screening van.
We're out here in the Tennessee mountains today, and it really speaks to the fact that you have a choice. You have a choice. You can stay in Chattanooga, you can stay in that big city, and you can complain about why are the people not coming to us. Or what you can do is you can get out on the ground. That might just be going to the local high schools and talking to them. That might be going to certain communities within the city, maybe churches, maybe community centers. You're getting away from the hospital and you're bringing it to the people, right? So definitely education is important, but access is critical. Are we just saying it's a problem, or are we doing something about it?
How do we spread what worked here into other areas that have also rural populations and inner city challenges, and take our model and do it even better? What an exciting career for somebody who is looking for something cool to do. What I've learned getting outside the operating room, connecting with these communities, understanding their needs and diseases and their challenges has been impactful. And your ability to change a population, change a town, change a city will only happen by getting out of the operating room and going to the people that you care about.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.